Hi, hello, I am Dr. T. Raghu, at present working as professor in the Department of Cardiology at Rajarashtra Medical College of Science. Today I am going to discuss briefly about the recent advances in the management of aortic stenosis. All of you know there are 4 chambers in the heart and 4 valves in the heart. Left-sided valves like aortic valve, mitral valve, and right-sided tricuspid and pulmonary valve. And aortic valve is between the aorta and the left ventricle when left ventricle pumps blood to all the organs of the body. And aortic valve disease is more common and is increasing in proportion because of aging population. Common cause of aortic stenosis in children is due to bicuspid aortic valve, which is about 2%. In adults, it's rheumatic valvular heart disease, and in elderly people after 65 years, it's a degenerative calcific aortic valve disease. It's almost 3% when they are in the age group of 65 years. It can go up to 12% at the age of 80 years. And most of these patients will be asymptomatic and they don't have symptoms for a longer period of time. Once they develop symptoms like chest pain, giddiness, syncope, breathlessness, or easy fatigability, they deteriorate fast and most of them die within 5 years of onset of symptoms. So initially, surgery was the treatment of choice. For last 5 decades, initially aortic valve surgery started in the year 1960. Till 2010, aortic valve surgery is the only treatment for the replacement of aortic stenosis. From last 2 decades, transcatheter aortic valve replacement has become an important modality for the treatment. It was in the year 2002, Dr. Alain Crebier from Rouen, France, first did his aortic valve replacement through transfemoral route. And he produced a paper of 44 patients with very good result, and all the patients where surgery was contraindicated and high risk for surgery. Since then, there are a lot of innovations, and every day almost in India only 10 to 20 surgery aortic valve replacement procedures have been done. In all over the world, 200,000 of transcutaneous aortic valve replacement procedures have been done. Advantage of transcatheter aortic valve replacement is easy to do, simple femoral artery puncture, and we use catheter. Aortic valve is introduced from the catheter and replace the valve. And there are important diagnostic indications are there. We have to evaluate the valve properly by doing an echo, 3-dimensional or 2-dimensional. CT angiogram is a must to assess the aortic valve morphology and assess the aortic route and also femoral artery size. So sometimes we have to assess the distance between the aortic valve and the coronary artery. If the distance is less than 7 millimeter, then difficult to implant a transcutaneous aortic valve replacement. And one of the advantages of this valve is easy procedure. It takes 1 to 2 hours under local anesthesia, very rarely under general anesthesia. And most of them go within 3 to 4 days. And complications are minimal. However, there can be a complication of stroke, or there can be higher incidence of complete heart block, which may require permanent pacemaker implantation. To prevent stroke, actually we are using a sentinel devices, a filter across the carotid arteries, so that you can prevent an embolic stroke. And disadvantages of surgery is because longer hospital stay and higher chance of infection and higher chance of post-operative pain is an important complications or limitations of aortic valve surgery. Then at present there is a 10-year data available with respect to transcutaneous aortic valve replacement, where results are comparable to surgery. Recently in October 2023, Partner 3 trial results were announced, where they studied about 7,000 patients in low and intermediate risk patients, that means patients more than 65 years. When they have compared with surgical and transcatheter aortic valve replacement, which are comparable, very effective, and the 5-year follow-up data is comparable to surgery. So in the years to come, probably transcatheter aortic valve replacement is going to be the treatment of choice, and it's going to grow with the newer innovations and newer catheter, newer balloons, and also newer valves. Thank you.